Hey guys, this is Dr. Hub. Today we look at the fractures. Fractures is going to be of the temporal bone. So first we are going to begin with the longitudinal. So only talking about the longitudinal. The longitudinal, the incidence is about 80%. Then what about the incidence of the facial nerve injury? So in terms of the incidence of the facial nerve injury. So the answer here is that it is about 20%. Next is what about the onset? The onset is that it is delayed. Next is what is the segment which is involved? The segment involved is the tympanic. Then comes the question on the type of injury. What is the type of the injury? The type of injury is the parietal. There is a parietal blow which is present. So you might have a question, what are the structures which are involved in the longitudinal? So here the structures involved, it includes, there is a tympanic membrane. The tympanic membrane is the ear bleed. Then comes the tegmen. And here there is a CSF arteria. The CSF arteria. Next comes the ossicles. Ossicles for the conductive hearing loss. So this was all about the longitudinal. Next we move on to the transverse. So in terms of transverse, the incidence is about 20% and the incidence of the facial nerve injury. So facial nerve injury, this is about 50%. So what about the onset? The onset is, it is immediate. It is immediate. Next, what are the segment which is involved in terms of transverse? So the segment involved is nothing but the meatal. It is the meatal or the labyrinthine. So next is what is the type of injury? Type of the injury. The type of injury is the occipital blow. There is occipital blow. And what are the structures which are injured? The structures injured are there is a labyrinth, there is vertigo. There is labyrinth, that is the vertigo. As well as there is the 8th nerve. So the 8th nerve is nothing but the sensory neural hearing loss. So there is a sensory neural hearing loss. So this was all about the fractures in the temporal bone. We saw the longitudinal and the transverse, and we saw few details regarding them. To learn and grow daily like this, please do subscribe.